Well, you know that times are very tough for young people these days. Do you think that a degree is the best guarantee against unemployment?
Like they have to have a degree too. I think for example, like for example, for me, I don't really have to pay if I go into university. I don't have to pay for my my tuition. I think the only scare is the amount of money they have to pay. I think that's the only scare. But for the degree, I think we need because there's some things you don't need a degree for, like for example retail and stuff like that. But we work with people. We are saving lives for, well, not me, but the nurses are saving lives. So I think they need to have the best qualifications they can get, so they can treat people and save them, rather than just, I don't know, if someone is dedicated to do what they want to do, nothing can stop them.
Okay. What are your perceived weaknesses?
Well, my perceived weaknesses, I think the first one is getting attached to people. I think that's my very, very weakness. And because I will forget that this is my job and I have to have a line of professionalism. I am all professional, but sometimes, like, I'll give you an example. In my care home, I've had this lady, she's called Janet, and she has, what's it called? I don't know. I forgot she has a disease. I think the disease is a disorder. Mm-hmm. So she forgets every time. Like today, I'll come in and she will remember me, and she remember all the things we did before. And then just one day, I'll come in and she'll not recognize me. Mm-hmm. Right? And she's so every time she sees me, she lightens up. She gets very, very happy. Like, oh my God, I'm so happy. You've made my day. And that makes me feel so great. Mm-hmm. Because I'm a human. I'd like validation that I'm making someone's life, I'm making somebody happy. So with that, every time I come, she's the first person I go to. Mm-hmm. Yeah, because then she's going to, like when I wake up in the morning and I'm so tired, I'm thinking I have to go and see Janet. You know, she's like my main, but because out of everybody, when she sees me, she lightens up. So I have a soft spot for Janet. So I think that's my weakness, because then I'm like, I can't get so attached to this person, and I think that's my weakness, of attachment.
Attachment. So maybe attachment, do you think maybe
Yeah.
Okay. What other careers have you considered to apply for?
It was either midwifery or nursing. Mm-hmm. That's it.
Okay. And why did you choose to apply to this university in particular? And what factors have influenced your choice?
Because I went there for it was like a tested day, like for a whole day, and you could just see the atmosphere was very warmly, and it wasn't really crowded, because I like, just be spacious, and and people didn't look rude at all, and stuff, as in the people that welcome us were really welcoming, and I know people that have come here have studied here, and they really have very, very good reviews with it, and I wouldn't really find any other, because when you tell me where do you want to go, this is the first place I would say, and then of course the rest will come later, but this is
Okay. If you had a large amount of money to spend on healthcare, what would you spend it on, and why?
If I had a large amount of let me see. I think I'll spend it on making like the equipment. Yes, there is equipment, but I'd make it more equipment, so that people don't have to.
What kind of equipment do you think about?
Like I'll just like X-rays, and for example, I'll make sure that like X-rays, because sometimes people they take long to get their results. For example, when my dad had it had to take him another 2 weeks for them to understand what the cause was and give him the test. Because we as a family, we're waiting. We're like, what, why kind of thing. So if they broke the news to us, earlier on, it would be like, but then they give it that long period before they give you the results. So for some reason, because I'm not in the hospital, I don't know anything in there, I'll just presume that they have too many things to do, too many patients to assess, like the X-ray and going into to test what happened. Or I would also use the money for, I think, more surgeries, should I say? Like you see the little one we have outside there, maybe a few more so that people can have. And I would also have I'd get the money and employ more people.
Mm-hmm. Okay. What has been your greatest achievement?
My greatest achievement.
Yeah, or describe a situation in which you took responsibility.
Okay, I will give you an example of. Let me see. I think it was a nursery, and my best achievement. I'll give you my best achievement. I think it was first of all in nursery. There's this child who just came in. He was like an outsider. And he was from Poland, and he could not speak English, and I had to find a way of interacting with this child. And if again, he's a child, his speech. I won't say his speech. He hasn't developed well to talk to me like how you talk to me. So I had to find my way of, talking to him through like pictures or I'll draw something, and then he would laugh. Because I think he just gets in his head, and I really when you left and he was smiling, and that's for me that's the greatest reward I could get. Somebody appreciating what you're doing. And the other one is, for example, in the care home, I had to go in, and there's this lady. She speaks to me, but I don't understand what she's saying. Right? So I'm always guessing. So do you want tea? And she'll be like, no. I'm like, okay, what do you want? Do you want biscuits? And she'll be like, no. I'm really trying to go in and find out what she wants until, I get it. And if not, I will call somebody up and they'll help her.
What computing skills do you have, and are those skills necessary for a nurse?
Computer skills, I will learn. I'm a very quick learner on the computer because I never went to any lessons. I just learned as I went along. But the skills I have is I can type anything. I'm a quick typer, and I could make, as I told you before, in my care home, every time a manager wanted for me to do something on my laptop, she could call me and I'll do it straight away. And I could draw schedules of the week, of the month, of the day, and I could really do anything on there.
Okay. Do you think that your predicted grades reflect your abilities?
Nope. I don't think so, because my predicted grade was MMM, and as we go along, I'm really doing the distinctions, and I don't really see. Maybe the grades are telling me this is at the beginning before I started my courses like 2 years ago. So with then I have really improved a lot, and I've been targeting to do all my distinctions so that I can get a very, very good grade. And my teachers claim I'm capable of getting a DDD or a DDM. So.
Okay, finger crossed.
Yeah.
So thank you. Do you have any questions?
No, thank you.
No? Mm-hmm. Okay, thank you, Shannon.
You're welcome.
Bye.